हेलो एवरीवन, सबको मेरा नमस्ते, सबको मेरा प्रणाम। मैं नेहा आज आप लोग के सामने फिर से हूँ एंड टुडे वी आर गोइंग टू टॉक रिगार्डिंग द liver cirrhosis. What is liver cirrhosis? What are the causes of the liver cirrhosis and what are the signs and symptoms of the liver cirrhosis? So liver cirrhosis is nothing but it is a chronic, progressive, irreversible, destructive disorder of the liver. Means cirrhosis word comes from the Greek word which means cirrhosis. Cirrhosis word means yellowish. There will be yellowish color in the body, means it indicates the jaundice condition. So what is the definition of liver cirrhosis? So liver cirrhosis, it is nothing but it is a chronic, irreversible, progressive, destructive disease of the liver, and in this the normal cells, that is hepatocytes, will get affected in the liver cirrhosis, and the scar formation will happen in the liver, and that scar formation will lead to necrosis of the cell, and the cell dead will be there, and the liver will not function properly. So these all things will happen in the case of liver cirrhosis, and portal hypertension will also there. So portal hypertension, the main cause of portal hypertension is liver cirrhosis only. So there are various function of the liver. So liver metabolize the estrogen hormone. Liver is responsible for producing the RBC. Liver is producing the bile every day, and liver is working as a detoxification machine. Means it detoxify the harmful substance and harmful medicines from our body. So liver helps in the digestion process. So these all things will happen in the liver. So think, if our liver is not working properly, if the liver function is impaired, so what will happen? These all things will not function in our body. So this is the main thing regarding the liver cirrhosis. So next we are moving to the causes of the liver cirrhosis. What are the causes of the liver cirrhosis? So the main cause of the liver cirrhosis is alcoholism. Alcoholism means if there is a chronic alcoholism since like 10 years, 15 years or 20 years, if the person is taking alcohol, and that will lead to the liver cirrhosis. What will happen now? The alcohol will change into acetate, and the acetate is a form of acid, and it will mix with our blood, and there will be more acid in our blood. So these will affect our body cells, and it lead to the liver damage or liver cell damage, and lastly it cause the liver cirrhosis. So alcoholism is the most common cause for the liver cirrhosis or liver damage. Next one is the any viral disease like hepatitis will be there. So hepatitis, HIV, these things will also cause the liver cirrhosis. Next one is hepatotoxin damage. Means if hepatocytes cells will get damaged, necrosis is there, cell death is there, so liver cirrhosis will occur. Next one is the cardiac problem. Cardiac problem means right side failure, cardiac disease will be there, so these will also lead to liver cirrhosis. Next one is bile duct inflammation. In liver cirrhosis, what will happen? So helper cell will attack on bile duct, and bile duct inflammation will be there, so bile will not secrete properly, and there will be bile stasis and necrosis will be there. So liver cirrhosis may happen because of venous congestion present and destruction of hepatocytes, and this will lead to hepatocyte damage, and that will lead to large congested liver, and it will cause the liver cirrhosis. So these things we have seen that these all the causes of the liver cirrhosis. Next, if you are moving to another cause, like some of the medicines are also responsible for the liver cirrhosis. First one is the temoxifen, which is a drug of choice for breast cancer. Second one is the methotrexate, which is a drug of choice for the rheumatoid arthritis. Third one is the sodium valporate, which is a drug of choice for seizure in pregnancy. And next, the amiodarone and steroid. These all medicine can cause the liver cirrhosis. And according to Mosby, book said that Bud Cherry syndrome also responsible for the liver cirrhosis. The classical symptom of Budd-Chiari syndrome are ascites, abdominal pain, and hepatomegaly. So these three classical symptoms will present in the Budd-Chiari syndrome. So what are the causes of the liver cirrhosis? First one is the alcoholism, which is most common. Second one is the viral disease or viral infection. Third one is biliary duct inflammation, and fourth one is the cardiac involvement, cardiac disease like right side heart failure. And medicines. So medicines, if you are talking, so temoxifen and methotrexate, sodium valporate, amiodarone, steroids, and Budd-Chiari syndrome according to the Mosby. So next, if you are talking regarding the sign and symptoms, so there are more sign and symptom in liver cirrhosis. In GI system, we can see the nausea and vomiting. We can see the mild abdominal pain. We can see the organomegaly like hepatomegaly will be there. Liver size will increase. Jaundice will be there. Yellowish color of the skin like sclera, and nail beds. Clay color stool. Yellow color urine. Ascites will be there. Esophageal varices will be there. Dilated esophageal veins. In esophageal varices, what will happen? Dilated esophageal vein will be there due to portal hypertension. The hemorrhoid and piles will be there. Hemorrhoid and piles will be there. In neurological symptom, we have to see for the flapping tremors, which is known as the asterexis. So this is a flapping tremors which we can see in the patient of liver cirrhosis. It happens because of the improper metabolism of the ammonia. So this things can lead to the flapping tremors. So the mild confusion is the early sign of the liver cirrhosis. Next one is sleep and wake cycle will be altered, memory will be altered level of consciousness will be there, paresthesia will be there, and hepatoencephalopathy. Hepatoencephalopathy is nothing but if the liver and brain both will involve. So it is because of high bilirubin level. So bilirubin level will be more than beyond level, so it will increase the impaired function of the brain, like thinking, reasoning, and mood, behavior. These all things will be altered. So the patient will do the altered behavior. The patient will not recognize the family member. The patient will not recognize herself. So these all things will happen in the hepatoencephalopathy. Next one, hematological changes. In hematological changes, anemia will be there, impaired coagulation will be there, risk of bleeding will be there, and in renal system, GFR rate will be increased, ammonia, urea, and creatinine will increase. In dermatological changes, which is most important, first one is the itching will be there, petache, purpura, and echimosis. What is petache, purpura, and echymosis? It is nothing but red color rashes over the body, and if 1 to 3 mm, that is petache, 3 to 7 mm, that is purpura, and 7 to 10 or more than 10 mm, it is echymosis. And next we can see the pulmonary erythema. Pulmonary erythema is nothing but it is a red color palm. Red color palm. Why it happens? Because the estrogen will not metabolize by the liver. One of the most important function of liver is to metabolize the estrogen hormone. But in the case of liver cirrhosis, the estrogen will not metabolize by the liver, so it will shift inside the cells, and the palm of the patient will look red. So it is called pulmonary erythema. Next one is caput medusae and spider angioma. So what is caput medusae? Caput medusae is the dilated abdominal vein due to portal hypertension. And what is spider angioma? Spider angioma is nothing but it is a spider like appearance over the trunk of the patient. So these all things we have to check in the liver cirrhosis patient. And next we have to check for the endocrine system changes. Previously we studied that estrogen level will be increased and aldosterone level will also increase. Next, fluid and electrolyte changes. So in fluid and electrolyte changes, what will happen? Hypokalemia will be there, hypernatremia will be there, and hypovolemia will be there. So hypovolemia and hypokalemia, potassium level will be down, fluid level will be down, but the sodium level increasing in the liver cirrhosis. So these things we have to see in the liver cirrhosis patient. Next, we need to talk regarding the diagnostic evaluation, means what are the tests we need to perform in the liver cirrhosis. So if you're talking regarding the diagnostic evaluation, so first will be SGPT, which is also known as ALT. ALT is alanine aminotransferase, and SGPT means serum glutamate pyruvate transferase. The normal value is 4 to 36 unit per liter. It is the most specific enzyme for the liver disease. So whatever liver diseases will be there, the first diagnostic evaluation will be, the first test will be ALT or SGPT. Next is the AST or SGOT. AST means aspartate aminotransferase, and SGOT means serum glutamate oxalate acetate amino acid. So these two are the specific enzyme we can say in the liver disease. So the normal level of SGOT is 0 to 35 unit per liter. Next one is the ALP, alkaline phosphate. So we have to go for the ALP. The normal level is 35 to 120 unit per liter. Next one is the serum bilirubin, which is most important in the liver cirrhosis. So then there are two type of bilirubin, direct bilirubin and indirect bilirubin. Direct is also known as conjugate, and indirect is also known as inconjugate. The normal level of direct bilirubin is 0.1 to 0.3 mg per dl, and indirect the normal level is 0.2 to 0.8 mg per dl. The total means both are 0.3 to 1.1 mg per dl. So in liver cirrhosis now, bilirubin will be very high, and it is more than like a normal level. So it can lead to hepatoencephalopathy. Already we have studied. Next one, we can go for serum albumin level. So it is the normal level of serum albumin is 3.5 to 5 mg per dl. Next, we can go for PT-INR. Why? Because there is coagulation impairment. So we have to go for PT-INR. The normal level is 9.8 to 11.6 second. We have to check the coagulation study. So next we can go for the CBC, and next the most important thing, liver biopsy. So liver biopsy is one of the important diagnostic evaluation. So liver biopsy is a confirmatory procedure for the confirmation of the liver cirrhosis, and during procedure we have to give the left lateral position to the patient, and after the procedure we have to provide the right side lateral position, and with the pillow under the costal margin. So they are asking in exam, they are asking the position in liver biopsy during and after. So during you have to give the left lateral, and after you have to give the right lateral and pillow under the costal margin. Next we have to measure for the hemorrhage after the liver biopsy. So these all things we have studied, that what is liver cirrhosis and what are the causes and what are the signs, symptoms, and what is the diagnostic evaluation. Next we can move to the management of the liver cirrhosis. So what are the management? First we will talk regarding the medical management. So a drug of choice. First, drug of choice of liver cirrhosis, the Neomycin is a drug of choice for the liver cirrhosis. Next drug is vasopressin. Vasopressin will constrict the blood vessels to control the bleeding. Next, beta blockers. We have to give beta blockers because portal hypertension is there. So to control the portal hypertension, beta blockers will provide to the patient. Next, vitamin K injection because of coagulation impairment. Next, antacid because of the gastrointestinal changes. Next, antiemetics because of nausea and vomiting, and diuretics means ascites will be there, no, so the fluid will excrete through the urine. So we have to give the diuretics. Neomycin is a drug of choice for the liver cirrhosis, and it is a aminoglycosides antibiotics. So it is a basically antibiotics which is comes under the aminoglycosides, and it will kill the normal flora of the intestine and decrease the ammonia formation. We already studied that ammonia will increase in the liver cirrhosis. So what will happen if neomycin will be there? So neomycin will decrease the ammonia level, and protein metabolism will be not there, no albumin will be there, and no symptoms occurs. Means all these things will subside, so symptoms will not occur. So that is an important medicine in the case of liver cirrhosis, because it will act as a hypotonic solution, and it will catch the ammonia, and it will excrete the ammonia from the body. So these things we can give in the liver cirrhosis patient, and vitamin supplements also we need to give in the liver cirrhosis patient. So next one is the management. What are the other management we can give in the patient? So first, dietary management. Dietary management, what we can give in diet. So if the ascites or edema present but the ammonia level is normal, then give the high protein diet like 50 to 100 gram per day. But if ammonia level is high, then we cannot give the high protein. We have to give less protein diet, that is 50 to 30 gram per day. And next, high calorie diet. We have to give the high calorie diet, and next, the overall calorie we can give 1500 to 2000 gram per day we have to give. Next, moderate food. We have to give the moderate food. Restrict the spicy food. Next, restrict the salt. We have to restrict the salt intake. And fluid, we have to reduce the fluid intake. Next, avoid alcohol. We have to give advice that you need to avoid the alcohol and sedative drugs, and check for the hepatoencephalopathy symptoms. So these all things we can give in the liver cirrhosis patient. If the patient is bedridden, if the patient is in ICU, so we need to give the total parenteral nutrition, and vitamin supplement we need to give. Then hepatotoxin substance which can harm the liver, which can provide the harmful effect to the body. So we need to avoid these things. And next, if the patient have the breathing difficulty, so we have to elevate the head of the bed. Next one is the intake output chart we need to maintain. Next one is daily weight monitoring. We have to take the daily weight of the patient. Next is the neurological symptom. We have to measure for the neurological symptom. And next, sign of the upper and lower GI bleeding. We have to check for the bleeding. We have to check for the coagulation factors. Next, keep precautions for the bleeding and infection. We have to we have to take a precautionary measure for the bleeding and infections. Next, prepare the patient for the paracentesis. So if ascites is there, so paracentesis need to perform, so prepare the patient for the paracentesis. And provide position. In semi-fowler position will be there in the liver cirrhosis patient if the patient is hospitalized, or resting position or feet supported. Okay, so these position you can give in the liver cirrhosis. So these all things we have studied regarding the liver cirrhosis. And liver cirrhosis is a very common condition for chronic alcoholism. Like my video, please like, share and subscribe. Thank you so much.